Morton's neuroma is a benign neuroma of an intermetatarsal plantar nerve, most commonly of the second and third intermetatarsal spaces. This problem is characterized by pain and/or numbness, sometimes relieved by removing footwear. Despite the name, the condition was first correctly described by a chiropodist named neuralgia, and although it is labeled a neuroma, many sources do not consider it a true tumor, but rather a perineural fibroma. Symptoms and signs. Symptoms include pain on weight bearing, frequently after only a short time. The nature of the pain varies widely among individuals. Some people experience shooting pain affecting the contiguous halves of two toes. Others describe a feeling like having a pebble in their shoe or walking on razor blades. Burning, numbness, and paresthesia may also be experienced. Morton's neuroma lesions have been found using MRI in patients without symptoms. Diagnosis. Differential diagnosis. Negative signs include no obvious deformities, erythema, signs of inflammation, or limitation of movement. Direct pressure between the metatarsal heads will replicate the symptoms, as will compression of the forefoot between the finger and thumb so as to compress the transverse arch of the foot. This is referred to as Mulder, a Euro unregistered trademark sign. There are other causes of pain in the forefoot. Too often all forefoot pain is categorized as neuroma. Other conditions to consider are capsulitis, which is an inflammation of ligaments that surrounds two bones, at the level of the joint. In this case, it would be the ligaments that attach the phalanx to the metatarsal bone. Inflammation from this condition will put pressure on an otherwise healthy nerve and give neuroma-type symptoms. Additionally, an intermetatarsal bursitis between the third and fourth metatarsal bones will also give neuroma-type symptoms because it too puts pressure on the nerve. Freiberg's disease, which is an osteochondritis of the metatarsal head, causes pain on weight bearing or compression. Histopathology. Microscopically, the affected nerve is markedly distorted, with extensive concentric perineural fibrosis. The arterioles are thickened and occlusion by thrombi are occasionally present. Imaging. Though a neuroma is a soft tissue abnormality and will not be visualized on standard radiographs, the first step in the assessment of forefoot pain is an X-ray in order to evaluate for the presence of arthritis and exclude stress fractures reactions and focal bone lesions, which may mimic the symptoms of a neuroma. Ultrasound accurately demonstrates thickening of the interdigital nerve within the web space of greater than 3 mm, diagnostic of a Morton Euro unregistered trademark as neuroma. This typically occurs at the level of the intermetatarsal ligament. Frequently, intermetatarsal bursitis coexists with the diagnosis. Other conditions that may also be visualized with ultrasound and can be clinically confused with a neuroma include synovitis capsulitis from the adjacent metatarsophalangeal joint, stress fractures reaction, and plantar plate disruption. MRI can similarly demonstrate the above conditions. However, in the setting where more than one abnormality coexists, ultrasound has the added advantage of determining which may be the source of the patent Euro unregistered trademark S pain by applying direct pressure with the probe. Further to this, ultrasound can be used to guide treatment such as cortisone injections into the weeb space, as well as alcohol ablation of the nerve. Treatment. Orthotics and corticosteroid injections are widely used conservative treatments for Morton Euro unregistered trademark S neuroma. In addition to traditional orthotic arch supports, a small foam or fabric pad may be positioned under the space between the two affected metatarsals, immediately behind the bone ends. This pad helps to splay the metatarsal bones and create more space for the nerves so as to relieve pressure and irritation. It may however also elicit mild uncomfortable sensations of its own, such as the feeling of having an awkward object under one's foot. Corticosteroid injections can relieve inflammation in some patients and help to end the symptoms. For some patients, however, the inflammation and pain recur after some weeks or months, and corticosteroids can only be used a limited number of times because they cause progressive degeneration of ligamentous and tendinous tissues. Sclerosing alcohol injections are an increasingly available treatment alternative if the above management approaches fail. Dilute alcohol is injected directly into the area of the neuroma, causing toxicity to the fibrous nerve tissue. Frequently, treatment must be performed €4 times, with €3 weeks between interventions. An 80 to €90% success rate has been achieved in clinical studies, equal to or exceeding the success rate for surgical neurectomy with fewer risks and less significant recovery, especially if done under ultrasound guidance. Radiofrequency ablation is also used in the treatment of Morton's neuroma. The outcomes appear to be equally or more reliable than alcohol injections, especially if the procedure is done under ultrasound guidance. If such interventions fail, patients are commonly offered surgery known as neurectomy, which involves removing the affected piece of nerve tissue. Postoperative scar tissue formation can occur in approximately 20% of cases, causing a return of neuroma symptoms. Neurectomy can be performed using one of two general methods. Making the incision from the dorsal side is the more common method but requires cutting the deep transverse metatarsal ligament that connects the third and fourth metatarsals in order to access the nerve beneath it. This results in exaggerated postoperative splaying of the third and fourth digits due to the loss of the supporting ligamentous structure. This has aesthetic concerns for some patients and possible though unquantified long-term implications for foot structure and health. Alternatively, making the incision from the ventral side allows more direct access to the affected nerve without cutting other structures. However, this approach requires a greater post-operative recovery time where the patient must avoid weight bearing on the affected foot because the ventral aspect of the foot is more highly innervated and impacted by pressure when standing. It also has an increased risk that scar tissue will form in a location that causes ongoing pain. Cryogenic neuroablation is a lesser-known alternative to neurectomy surgery. Cryogenic neuroablation is a term that is used to describe the destruction of axons to prevent them from carrying painful impulses. This is accomplished by making a small incision and inserting a cryoneedle that applies extremely low temperatures of between a 50 °C to a 70 °C to the nerve neuroma. This results in degeneration of the intracellular elements, axons, and myelin sheath with Wallerian degeneration. The epineurium and perineurium remain intact, thus preventing the formation of stump neuroma. The preservation of these structures differentiates cryogenic neuroablation from surgical excision in neurolytic agents such as alcohol. An initial study showed that cryoneuroablation is initially equal in effectiveness to surgery but does not have the risk of stump neuroma formation. However, the results from this procedure may not be permanent. Recently, an increasing number of procedures are being performed at specialist centers under radiological or ultrasound guidance. Recent studies have shown excellent results for the treatment of Morton's neuroma with ultrasound-guided steroid injections, ultrasound-guided sclerosing alcohol injections, ultrasound-guided radiofrequency ablation, and ultrasound-guided cryoablation. Morton's neuroma in popular culture. Dorothy Zbornak, a character in the NBC television show The Golden Girls, was diagnosed with a Morton's neuroma in the episode titled The Operation. Singer-songwriter and member of Aerosmith, Steven Tyler, was affected by Morton's neuroma and underwent surgery for it. Patrick Duffy recently said in an extra interview with Billy Bush that he had Morton's neuroma and had surgery to have the nerves removed in both feet years ago. Bob Harper, trainer of NBC's The Biggest Loser, currently has Morton's neuroma. See also, Mulder's sign, the Center for Morton's neuroma, a scientific discussion of Morton unregistered trademark as neuroma, references. External links, the Center for Morton's neuroma, useful resource for anyone with Morton's neuroma, active blog on personal experience having surgery for Morton's neuroma and recovery. Overview at Mayo Clinic. -664,076,278 at Notebook, who was Thomas George Morton, image gallery of MRI and ultrasound evaluation of forefoot pain.